Ambulation success with tethers. Definition of a tether is any line that is attached to the patient that prohibits full range of motion. Examples of tethers include blood pressure cuff, IV or oxygen tubing, IV tubing, Foley catheter, sequential compression devices, and not shown in this demonstration are EKG leads and also tube feeding. Now, to pre-plan, we want to ensure that the patient has a clear pathway. We want to make sure that if they have 2 or more tethers, we utilize the help of an assistant. We want to ensure that the bed is low and locked, with 2 side rails up at all times. We want to use the assistance of a gait belt and non-skid slippers. And we also want to try to limit the tethers as much as possible. So we can ask the nurse if we can saline lock the IV or stop and disconnect the tube feeding temporarily while we ambulate the patient. We also want to ask the patient, we want to make sure we check for a Foley, ask the patient if they have any tugging before they stand, any pressure. And then we also want to ask the nurse how many tethers the patient does have. So we want to communicate a backup plan, so we have the second nurse or tech follow behind the patient with a wheelchair, or we can have them hold on to the oxygen tank with their non-dominant hand and grab the patient with the gait belt with their dominant hand. Now to ambulate the patient, we want to make sure we secure the Foley catheter lower than the patient's waist to help prevent infection. And we also want to position ourselves to where we have our non-dominant hand on the oxygen tank, and we want to make sure the walker is in front of the patient where she can reach it, but not have to strain and struggle to reach it. So, we'll grab the patient, make sure she leans forward to help assist us. 1, 2, 3. Once the patient has a hold of the walker, grab the oxygen tank, and we will begin ambulation. Now we want to frequently assess the patient and make sure that she's doing okay by asking questions such as, do you feel lightheaded? Do you feel like you can walk a little bit more? And ask if she needs to go back to her room. With ensuring that your backup plan has been implemented with the wheelchair followed behind you.